Hello, everybody, and welcome to this week's episode on Fit as a Fiddle. I am very excited to have our wonderful guest for today, Kenna Bouvet. She is a licensed acupuncturist and the co-owner of Earth and Sky Massage and Acupuncture in Long Island City, New York. I connected with Kenna some time ago. Actually, it's been a couple of years now, well before COVID that we connected, just regarding patients, and we had a mutual connection at the time. And so now here we are to talk about prenatal health and the just general acupuncture and wellness within the perinatal population. Obviously, people hear a little bit about what is acupuncture, what is Chinese medicine, but there's so much that is very patient-centered and very unique to the perinatal population that Kenna is going to talk to us about today. So without further ado, welcome to the show, Kenna.
Thank you so much. I'm so excited to be here.
Absolutely. So before we dive into anything, I want you to explain the work that you do and what brought you into acupuncture in the first place, and a little bit about your interests in the field.
Awesome. So I had sort of the unique experience of getting acupuncture as a child. I had a wonderful mother who I had some health issues, and she sought an acupuncturist out, and that sort of shaped my, I think, health in general as I grew older, and constantly returned to acupuncture at different phases in my life, and it always just had a huge impact. And I think that's how I sort of circled back around to it now, and it has become my career. And yeah, I deeply enjoy working with the perinatal sort of population. I think it's a very important time. I would say, any licensed acupuncturist is qualified and can really help in this time. However, there are definite avenues licensed acupuncturists can go down that really help sort of set them apart and really support in a more effective and safe way. I would love to just say I've studied with Deborah Betts and Claudia Zivkovich, who have had huge impacts on my learning and have just taught me so much over the years. And I'm very thankful to them because it's a special time, the perinatal, prenatal into labor prep, and then postpartum. And I think, I'm constantly learning more and more about this time and better ways to support my patients, for sure.
Yeah, I love that. And working in the population, I think it's also interesting to see. I always say, like, pregnant people and teenagers are very similar in that they're growing and everything is changing. So if I'm getting somebody in with anything going on with their body, but their body is growing, it's like we're keeping up with everything and everything is changing. It's not a constant. We don't have it's not like a randomized controlled trial option where we can say this particular person with the exact same qualities and we do this particular treatment and then it's going to go exactly this way, because the next week they're going to walk in and there's like something else
Totally new. Yeah, it's humbling because you never know, and you have to take each day as it comes with them and what they bring you that day and meet them where they are. And yeah, it's a good analogy to teenagers.
Yeah, I love that. So amazing. So I want you to tell us a little bit about your time working in oncology with cancer patients, because I think that really quickly before we dive into the prenatal stuff, just for listeners, because this is all just about education, there's so much to acupuncture. And I think because I just saw that you have that background, I would love for you to just talk about how that's a very unique space as well.
Yeah. So as I mentioned, having had acupuncture as a child, that is definitely another passion of mine. And I do treat a lot of children, and it sort of meshes really well with, I treat the moms and then they give birth and then I just sort of start. And I think it's a really beautiful way to just treat the whole family. And it sort of sets, like it did for me, it sets up the whole stage for really good health from the beginning. So in school, I definitely sought out extra certifications and trainings in pediatrics, and then sort of got hooked up in the pediatric world. And there was, an opening in the Pediatric Oncology, Hematology, and Stem Cell Transplant division at Columbia Medical. So I would say the oncology sort of came because I had training in pediatrics, and you need that sort of knowledge and education in order to work there. So, but it was it's an amazing division to work in. talk about humbling and just learning so much from the patients. And I think in general, treating kids it teaches you so much, and it definitely brings the inner child out. And it keeps you on your toes. You kind of have to be a magician and take, every second as it comes, and be very, very flexible in the work, but it can be very effective for children. And just, I think in as much as being an effective, acupuncturist or integrative clinician, we did use a lot of integrative therapies at the hospital. I think it's, in that population, in that situation, it's a lot about presence and just support and being a very calming, sort of gentle touch person in the room, because, the patients, the kids are going through a lot that, many adults can't even imagine. So it's sort of just offering, I learned a lot about just the importance of holding space for the kids and the families. And it's wonderful. I've learned a lot.
Yeah, I think we share a little bit of background there because when I graduated Columbia Medical, I spent a little bit of time in the NICUs and the PICUs, so neonatal ICU, pediatric ICUs. I'm still working with pediatrics, like even via telehealth. I have my little doll that I use to demonstrate things, but it's a very, very emotional space in a lot of ways. Definitely blends in with, perinatal health and a lot of the things we're going to talk about right now. But it's a very different world working in an acute care space with babies and little kids than it is working in an outpatient. I treat babies at home for developmental delay, and it's a very different ballgame, but at the end of the day, it's still very rewarding. And it's just very different than, it's very innocent. It's very caring. And there's just so much to pediatrics that I think as a clinician, I think it helps me become better. Like the patience you need, and just like the ability to communicate with somebody who can't communicate with you through other ways, and be able to make a connection with another small human being.
I mean, it's so different in terms of like the communication is a whole different realm. And these children have gone through a lot, but they're still kids, so they haven't gone through the lists and history and years that adult patients come to you with, right? So you piece things out a little bit differently, and then communication wise, like you said, it makes you be a better practitioner, because you're just having to push yourself to get on their level without talking sometimes.
I like what you just said. Actually, it's interesting, because I don't think I've actually thought about it that way, that they don't come in with the history, and also in some ways that psychosocial, like the preconceived notions, expectations of what treatment should look like, what your benefits of treatment can and should be. You're absolutely right. It's a completely different world. I know we can dive into that as like a whole thing, but I wanted to just touch on it for listeners to know that, hey, babies can get acupuncture, kids can get acupuncture. It's everyone is capable of healing and becoming well through all these kinds of modalities. So can we dive right into some perinatal stuff?
Yes.
Okay, so I'd like to first talk about from conception, because obviously it's this whole trajectory, and I know you work across that trajectory very closely. So I'd like for you to start touching on what are some of the techniques or benefits of maybe even preconception, trying like fertility, thinking about fertility. What are some things that you like to educate your patients on?
Yeah, so it definitely starts with conception. And I like to kind of say, a lot of people will come to me for, when they try to start conceiving, or if they're having conception difficulties, I like to say. And I work with people that are just sort of naturally starting to work on conceiving, or are going through, IVF or IUI. And I think acupuncture is just so wonderful, because at the core, it treats the root. So it really looks at what this person constitutionally needs support and nourishment with. And working even from just that alone can really help everything else, maybe the more symptomatic things. But then on a more superficial level, right, acupuncture in and of itself just can bring such circulation and nourishment to certain areas of the body. So a big focus in those treatments, those, conception treatments, would be, making the reproductive organs, the pelvis, hospitable to what we want to take place. So opening up all the channels that go through the pelvis, go through the reproductive organs, bringing, good substances we call blood and qi to that area, warming, making sure it's warm, cold. We want nothing cold. And that's in terms of, I have people really look at their diet sometimes if they think that's important, and just even outfits and how they're sort of protecting that area during that time. And then, we have things kind of layered on top. Stress is just a huge thing depending on what's going on stress-wise in their life, work habits, exercise, and these type of things as well.
I love that. I love how holistic it is. It's like, you're like
Never
speaking my
one
language.
Thing.
I love it so much. And yes, you're absolutely right. There's so many components that goes into, it's not just a needle in one spot, right? It's like the whole picture. And I think that that's, what listeners can understand and take away from that is so many little pieces can contribute to your overall wellness. And it really takes all of those pieces to build the foundational blocks so that you can have, it's like if one piece is missing or there's a lot of pieces missing, it's not as optimal as, right. It's not that it's bad, it's just not as optimal. And so if you are thinking about optimizing that very special time of your life when you're trying to conceive, or you have just conceived and you want to, you're embarking on this journey where there's going to be a lot of changes in your body initially, I think that it's a really great idea to get, kind of like a baseline, understand where are you, what are your habits, what are the, I mean, you just mentioned clothing, right? Like I actually never thought about that. So having said that, what are your recommendations for clothing?
This is definitely like, it gets into the history of Chinese medicine and wise, elders, and what they tell women trying to get pregnant. Mm-hmm. But, it's important to keep this pelvic uterus area warm. So, if it's cold, like tuck in the shirt or wrap a scarf around it. And then a lot of the channels that run to that area start in the feet. So if people come in with cold feet, I put a heat lamp on, or I do moxa to warm that area. And then I often suggest, even walking around the house, please put on socks, just keep that area warm, because if it's cold in those channels, that's coming up the legs and into that area. And we just want to keep that as warm as possible. And like you said, it's not going to make or break it, but there's millions of things we can do to support this time. And I try to figure out what works with the person that comes in to see me. So, we might talk about 10 different things, but really choose 5 for them to focus on that fits in realistically with their life. Because in this area, conception, even the perinatal whole area, there's millions of things people can do. And I think it can get overwhelming. So I think it is important to sort of, pare it down and see what fits with their lifestyle and what interests them and what would be most effective for them.
Absolutely. I think it's a little helpful in New York City. I'm not fully aware of other parts of the country or other parts of the world, but in New York City, I feel like there's a lot of new wave of let's figure out what this whole thing is very early on. And I know that Instagram and social media sometimes is not helpful in that, because they're like, do this, do that, do this, do that, do this, do that. You're not supposed to do this. And then another thing will be like, you're supposed to do this. So there's sometimes an overwhelm of information, but I think that what you're bringing up is a really good point, that take what makes sense to you, work with somebody who's helping and guiding you through something that's customized, because all this stuff that you see online, it's for a very, very general population and not taking into consideration at all who you are and what your needs are or where you are at your pregnancy. So just working with somebody that can help guide you through some of these things, or a couple of different practitioners who are kind of coordinating care and making you get on the right track, whether it's working with a nutritionist separately, working with acupuncture separately, communicating this stuff with your OB to make sure, or your midwife or whoever, if you have a doula, making sure that everyone's on the same page with what your health is. I think that can be really helpful. And not to think oh, I have this checklist of I need to see 50 practitioners and then I need to do 50,000 things a day. That's too much. It's not going to work.
Yeah, exactly. Yeah.
All right. So let's go kind of into what you would think about during first second trimester, kind of like those early on phases, and when you're not necessarily like right towards the end, are there some unique things that you tell your patients, advice that you give, or even within your practice and within acupuncture itself, stuff that you focus on during that time?
Yeah, so definitely in the first and into the second trimester, most people are coming to me for just overall support, which I love. Sometimes there's not a pressing issue. They've heard or they've been told, or even better, their OB or midwife has suggested just acupuncture is wonderful to support the perinatal time. And in that way, treatments look very similar to as if they were just coming to me for any old thing. And we work on their constitution, which can really just help the pregnancy, right? Because anything they were struggling with before can sometimes become more apparent in the pregnancy. And so we really want to work on those things. But then, I think the quintessential things I often see are the nausea and vomiting, even going into hyperemesis, and then the digestive complaints of heartburn, indigestion, constipation. These are all big things that are quite, we see a lot. And I think there's been great research out there on the effectiveness of acupuncture, especially with nausea and vomiting. And then, I see a lot of up things that are kind of coming up with the sinus congestion or nosebleeds. These sort of things kind of come in around the transition from first to second trimester, when progesterone sort of shifting, and progesterone has an effect on these mucous membranes, and we just sort of get stuffy constantly. As well as with the constipation, the pregnancy hormones have a big effect on this. So I see often progesterone having different effects, like that constipation type person or that sort of loose stool type of person as well. So again, it's there's not like a one size fits all. It's definitely seeing how pregnancy affects the person in front of me. And as you know, it looks differently every time. And there's so many things that I'm learning constantly, like, oh, this is affecting this person like this. Well, what can we do to sort of harmonize things a bit more?
Yeah, I hear you. I think it's interesting that you just said that. I had a telehealth patient right before I jumped on this call with you. And there's usually like these certain patterns that you'll start seeing by session 2 or by session 3. This person is this particular trimester. I've seen this a bunch of times. I know kind of where this is going. And she came into the session giving me like a totally, not bad, but just a totally different like view of some of the things that we talked about. And I was just like, okay, I have to create a whole new bucket of categorization in my brain of like how somebody could respond or think about something that I taught them. And then that's really interesting. I was like, there's nothing wrong. I mean, I have like 7 different responses to this particular thing we talked about, but it's really interesting you said that, because there we go. There's another one. And I think you're absolutely right. We constantly learn from our patients. Our patients think we know everything. And I'm like, don't know everything. I know some things, and I might know many things in certain areas, but there's a lot that I don't know. And every time I treat a new patient, it's just like, wow, great. This is awesome. Wow, great. This is awesome. These patterns and these little things, these little idiosyncrasies are so interesting. So having said that, what is your most kind of successful kind of hyperemesis or morning sickness kind of story? So I know that people want to talk about that all the time, and they're curious to hear about what the benefits are.
Yeah, I think so. Again, coming back to, it's not one thing. I think acupuncture, like I said, there's been great research out there for nausea in pregnancy, morning sickness. So there are definite treatment protocols or points even that can really help that. I also think it's very important to diagnose the patient and what's the underlying cause of this nausea, because it's not always one thing. And so it's a mix of, yes, using these points that in research have really shown to be effective, plus a good diagnosis of what's really going on in this individual person you're treating. And that's been my most effective treatments, is when I really nail sort of the underlying cause of this nausea. And then, I think it extends further from that. Oftentimes we look at the prenatal vitamin they're taking, and sometimes that's a big cause of that. And I might suggest some others that I like, or for them to definitely bring this up to their OB or midwife. Also diet wise, making sure their protein intake is enough and making sure they're eating like at good intervals. Sometimes it's just, my patients will just be like, yeah, I forgot to eat all day. And then I was so nauseous and I was like, well, bingo, let's try to get in there with that. So, again, it's the acupuncture, it's this discussion, and it all kind of works together, to have an effective treatment for sure.
Amazing. Yeah. That's good advice though. Even just like basically looking at, you might be predisposed to morning sickness because of pregnancy, but then are there other things that might be contributing to it? And just taking a look at that, there's a lot of changes that are happening outside of just the hormonal shifts and the baby in your belly. And so whatever you could control, trying to make sure that you're on top of it, like eating your meals normally. That could be a good start. Amazing. Okay. Let's dive into second trimester and going into third, kind of like towards the end of pregnancy. What are your thoughts on the biggest complaints and things that you see?
Yeah. I think, I boringly could give a whole list of the prenatal acupuncture go-tos, but it's sort of, it's everything. I think there's so many things that we can really help with or work in conjunction with other practitioners. And I'm a big referral person for sure. I think in the second, moving into third trimester, I think more of the, heartburn definitely becomes more of a thing later on. I think the fatigue, insomnia, anxiety, those type of things sort of set in a little bit more. They're definitely apparent throughout, depending, but we definitely work on that. With the fatigue and the insomnia, it can just be discomfort. It can just be, just taking on so much more. Often in the second trimester, though, we do see a good amount of fatigue go away, which is great. And then it sort of sets back in that third trimester as well. And then, towards the moving into the third trimester, we start to really, work on the labor prep treatments. And I start a slow build with those. But I do like to start, all of pregnancy, just making sure the body is working towards that sort of time that's going to come. Something I'll also mention that I've over the years felt that is really important is working to prep or prevent postpartum stuff. So I think, we have so much attention on the prenatal time and even labor prep, but postpartum is often sort of like the baby's here. Let's just focus on the baby. So throughout the whole prenatal treatments, I often like to start talking about that postnatal time and keying into things that my patients can watch out for that I might see sort of happening, some bladder incontinence or these type of things that often really can come back. Shoulder pain is a big one if they're having it all through the prenatal time. It's a big thing for me because I know when they start breastfeeding or holding their baby, it's just going to come back with a vengeance. And so trying to address these things in the prenatal time, I've had a lot of good effect with then the postnatal time being a much happier time in ways.
You're
for sure.
Absolutely right. I'm 100,000% echoing everything you're saying right now, Kenna. It's unbelievable because you're right that as soon as the baby comes, mom or parent is just like, too many things going on. And it's so hard. It's really hard. And you don't want it to be like your back is shoved against the wall and it's so bad that you have to focus on yourself. It needs to be like kind of sprinkled throughout. But the reality is that it's, especially for new parents, it can be very difficult to get into that space where they can think about it. And one of the things I do actually is when I see somebody postpartum who's having a tough time with anything regarding their arm, neck, upper back kind of pain in their body, the first thing I do is set up their feeding station for them in their homes because I do the home visits. I see them in their homes and I'm like, whether you're breastfeeding or bottle feeding, where are you doing it? You're going to do it in this one spot each time. And it literally looks ridiculous when I set it up. And I take a picture and I'm like, it's okay because there are about 5,700 pillows, towels, and blankets that are supporting you. But guess what? You're just like dead weight and you're just kind of like there and you're supported and you feel so good. And they'll look at me and be like, I can breathe. This is how it's supposed to be. I'm like, yes, you are not supposed to be hunched over for like 17 hours a day doing this one activity, because you have to do it basically 17 hours
Yeah.
a day. But you're so right that teaching them this ahead of time, if I see somebody prenatally, I'll just like set that up for them before. So it's just like, they're so aware that this is going to be challenging, because it is for the majority of people, the things that are going to end up becoming somewhat challenging, just because it's a toll on the human body, not necessarily because they're doing it poorly, but because it's so many times a day that they're being asked to do it. So I'm totally on board with you in terms of making sure that you teach all that postpartum stuff well beforehand. If you can catch them, even in the first and second trimester, just start saying the things, and then they start to like, oh, okay, that's interesting. I have to care for myself. Oh,
Yes.
I have to like make sure that I'm not in pain when I'm rocking my baby to sleep. Oh, okay, cool.
Exactly.
Amazing. All right. So what else do you want to add in for the listeners? Is there something that very specifically into the postpartum that you look into, or you want to talk to people about or make them aware of specifically that you offer?
Yeah, I think, we touched a little on pain, but I think pain is another big thing that people come to me for, and acupuncture is very effective in, um, things like low back, hips, but then also carpal tunnel or smaller things, pelvic pain, calf cramps, these type of things. And then something that's, I think becoming more aware as better research comes out, but working with breach has been a big thing lately. And I've really enjoyed working with people and have seen good effect with acupuncture, and most effectively moxa, which is the mugwort herb that is burned, not touching the skin, but a little bit off, specifically on a specific acupuncture point. So, the best time to come for starting breach treatments is around 34 weeks, give or take. I do a full acupuncture treatment, again, treating their root, treating everything else going on, really opening up the hips, making space so that movement can happen, and then showing them how to do the moxa on the acupuncture point. And then I give very specific guidelines of the homework that they have. So it is involved, but if there is good compliance, which all the research has shown positivity when the people are compliant with the homework. And it takes about, I have them do it for 10 days at home, but I show them exactly how to do it. If their partner wants to come in, I'll show them. I give them the moxa, I give them a whole handout and really educate them on how to be most effective with this treatment. So that's a big thing. It can be a very anxiety ridden thing that people come to me with. And I think acupuncture, getting body work, chiropractor, and other exercises as well. With all of that, sort of, you're having your support team. I've seen a lot of lots of babies successfully flip, for sure.
I'm so happy to hear that. So listeners, I would highly encourage you, if you're thinking about pregnancy, if you are pregnant right now, if you even are postpartum, I think that everything that Kenna said today is incredible. There's so much research. It's an ancient culture. I mean, this stuff has been happening for years and years and years. People have been gaining the benefits and reaping the benefits of the treatments. So if you're experiencing anything, or if you just want to look into prevention and maintenance and wellness, I highly encourage you to check out Earth Sky. They are in LIC. I'll drop the website onto the show links on the show notes here. Do you guys have an Instagram that you want people to follow? Do you want to tell us the handle?
Yes, it is Earth Sky LIC.
Amazing. So follow that. And then I think it's just earthskylic.com for the website, if I'm not mistaken. And I hope that you guys see Kenna Bouvet or her colleagues or anybody else who's working in the clinic right now to get your treatment. And, just get this advice. It's good advice, stuff that you might not even be thinking about, but I think it can be so beneficial for the long term. So any other last words you'd like to add for the listeners today, Kenna?
No, I think I could talk about this stuff for forever, and it's so fun to chat with you. I think, there's endless things to learn, and I am so humbled by this work and humbled by all my patients. And thanks so much for having me today.
Absolutely, my pleasure, and we'll have you again another time too.
Sounds good.